Hello, my dear students. So, today's topic will be talking about the causes of hypovolemic hyponatremia, that is, low volume and low sodium in blood. Hypovolemic hyponatremia. So, to start with, before going to hypovolemic hyponatremia, I would like to start with low sodium. The causes of hyponatremia are broadly divided into hypovolemic, euvolemic, normal volume, euvolemic, and hypervolemic hyponatremia. I repeat, hypovolemic, normal volume, euvolemic, and hypervolemic hyponatremia. Okay, so in this discussion, definitely we'll be talking about hypovolemic hyponatremia. But still, when we talk about euvolemic, we'll just see what are the common things, that is common question for MCQ points. You need to know what are the common points you need to know. So the important point in hypovolemic is vomiting, diarrhea, diuretic use. So these are the 3 points that you need to know basically for your MCQ purposes. Okay, then for normal volume means you have to remember SIAD, syndrome of inappropriate ADH. SIAD is very, very important. Other than SIAD, hypothyroid is very important. Hypothyroid is very important. Then comes hypervolemic hyponatremia. So hypervolemic hyponatremia means you have to remember renal failure, chronic renal failure, or even acute renal failure, and then you have to remember cirrhosis. So basically these are the points that you need to know. I repeat, hypovolemic hyponatremia means vomiting, diarrhea, diuretics. Normal volume, that is euvolemic hyponatremia, means SIAD and hypothyroidism. Hypervolemic hyponatremia means CRF, that is chronic renal failure, or even acute renal failure, or even nephrotic syndrome, and cirrhosis. Okay, now we jump on to a topic, that is hypovolemic hyponatremia. So we only care about low volume hypovolemic hyponatremia. So this simply means the water content in the blood is lost, the sodium content in the blood is lost. So we are talking here about how the sodium is lost and how the water is lost. So there are only 2 possible ways you can lose it. So one is through kidney, that is renal loss. Another is anything other than kidney, that is extra renal loss. So these are the 2 ways you can lose out the fluid. So first we'll talk about renal loss. So if you have to know that this patient is having hyponatremia and hypovolemia, but he is having the loss through kidneys, that is renal loss, you have to measure something called urinary sodium. If the urinary sodium is more than 20, which means really he is losing his fluid from renal loss. So in physiology there is a rule, wherever sodium goes, water follows. So a lot of sodium goes in the urine. So really some problem is in the renal side. So water follows the sodium. So he is losing water along with this. So the number 1 situation you should consider in them is diuretics. A patient who is on diuretics to control his hypertension, for instance, recently his dosage has been increased, or he has been taking the drugs a lot and he is having diuretic excess. So this patient will lose, along with lot of urine, along with lot of fluids, water, he will lose sodium also. So whenever urine sodium is more than 20, you should consider diuretics is very important. Excess of diuretics, that's very important. Okay, the number 2 cause I want you to remember is bicarbonaturia, that is renal tubular acidosis with metabolic alkalosis. Bicarbonate being kicked out through urine. Bicarbonaturia, that is the second point you should know. And the third point you should know is salt losing nephritis. salt losing nephritis. So these three are very important whenever you find urinary sodium more than 20 in your MCQ. So urine sodium more than 20, what the MCQ is trying to tell you? They are trying to tell you that really there is some problem in the kidney. Look at the kidney, he is losing his sodium through the kidney, he is losing his water content in the body through the kidney. So it has to be either diuretics, or it has to be RTA metabolic alkalosis, that is bicarbonaturia, or it has to be salt losing nephritis. So these three are very important. Then comes one more thing, that is osmotic diuresis. But for your MCQ purpose, if you remember the first three, that should be fine enough. I repeat, diuretics, RTA metabolic alkalosis, and salt losing nephritis. So this is on one side. So till now we talked about the renal losses. Now we'll talk about the extra-renal losses. So patient is losing his sodium by the way of losing his the fluids in some other space other than kidneys. So the commonest is vomiting or diarrhea. It's very common. Next is edema. So that is third space, fluid loss, edema. Then comes burns. So these three are very important: vomiting, diarrhea, edema, and burns. These are very important. Then the next important is trauma. There can be definitely fluid loss in the patient. And pancreatitis. It be consuming lesser amount of fluid, pancreatitis. Okay. So to remember these, I have made a mnemonic, that is burnt pet loses fluid. Burnt pet, maybe a dog, maybe a cat. Burnt pet loses fluid. So burnt stands for burns, pet, P stands for pancreatitis, E stands for edema, T stands for trauma. So these four are covered. So loses fluid. How a person will lose fluid? Through vomiting or diarrhea. So this mnemonic, I hope, will be helpful for remembering the renal and extra-renal losses. So we talked about, I repeat, hypovolemic hyponatremia, in which if you will be able to remember, hypovolemic hyponatremia means vomiting, diarrhea, diuretic excess, along with RTA metabolic alkalosis, and salt losing nephritis. If possible, you can remember pancreatitis and burns, if possible. If not, that's okay. Bare minimum, you need to remember vomiting, diarrhea, diuretic excess. And normal volume, that is euvolemic, means higher than hypothyroidism. Hypervolemia means you're going to talk about CRF and cirrhosis. I hope this discussion helps. Thank you.